Diabetes is one of the leading causes of death among children and persons under the age of 30. In Ghana, there are no statistics on the number of children dying from diabetes, but it's estimated that 1.3 million deaths were directly caused by the condition. 3 out of 9 Ghanaians suffer from diabetes, and that's what makes it an alarming subject. Despite these challenges, the lifeline for diabetes patients is being snuffed out by officials of the National Diabetes Association of Ghana. My name is Kwete Nati, and in this edition of Hotline, I explore the ripoff of the donor agency supplying diabetes drugs and scores of children living with diabetes by officials of the Diabetes Association. Meet Reverend Gifty Limor Menu. In her late 50s, Reverend Menu is one of the directors of Nicole Helpline. It's a foundation that sensitizes parents with children living with diabetes to better take care of their kids. Reverend Menu and her husband set up the foundation after they lost their second daughter to diabetes.
It is challenging financially. I mean, if you are below a certain level of income, it can be challenging purchasing the insulin, purchasing the strips, getting the glucometer. But we were able to manage somehow. Our priorities changed. We made a lot of sacrifices. It still was challenging, but we made a lot of sacrifices and adjusted. And
a teary Reverend Menu shares the last moments of her daughter. Let us walk through it, a bit sorrowful, but Nicole's last moment. How was it?
When we we picked her from her friend's place on a Thursday, I think, and then we took her first to Coco Clinic, where she was admitted for the night, and then we were asked to go to Kolebu the following day, which was a Friday. So we went to Kolebu and went immediately into the emergency unit, and then she was given treatment, and then they said to do a test, and then took her over to the ICU unit. For a day or two, we couldn't really communicate with her. But the last day, we talked with her. We had some exchanges. She was still even talking about her friends and what they had to do because she had just finished O-level. So they were talking about the party stuff, the things they had to do. So she was quite... we had a meaningful conversation, but I mean, not along the lines of somebody who knew she was... No, that was the last time she was going to see her. So we left her quite in high spirits, even though we realized that her breathing was faster than normal. But we were not expecting that we would come back to meet an empty bed.
But there is an intervention to ensure that no child dies from diabetes. That's the partnership between an Australian donor agency, International Diabetes Federation, and the National Diabetes Association of Ghana, under the Life for a Child program. A memorandum of understanding signed between the two bodies states that children living with diabetes are to be supplied with insulin, glucometers and strips free of charge. Elizabeth Denyo is the president of the association.
We're looking at people living with diabetes nationwide, but our special attention is on children living with diabetes. The Life for a Child Foundation is a branch of the International Diabetes Foundation. Their mission is no child should die of diabetes. So currently throughout the African sub-region, we are making sure every child living with diabetes at least gets strips and to test their sugar, glucometers to test their sugar and insulin to keep them alive.
But there is a ripoff of these vulnerable patients living with diabetes. JoyNews checks reveal some officials appointed by the National Diabetes Association of Ghana are selling the strips and glucometers instead of distributing them for free to the poor patients. This was how the Hotline team uncovered this. I posed as a research officer conducting a survey for the donor agency supplying insulin to to the National Diabetes Association to investigate claims of the drugs being sold to patients. At the WA Hospital, retired nurse Mary Diano is the medical officer appointed to distribute the specially labeled diabetes drugs at the hospital to persons living with the condition. But she was selling the diabetes strips and insulin to her patients. This was what transpired when I put the issue to her in a telephone conversation.
So there are many. It's just that we had challenges with so many things.
What were the challenges?
The challenges are we didn't have the kits. We didn't have the diabetic kits. They are so expensive even when we get them. And a lot of the patients could not even buy, and anytime they come, we have to check their sugar level, take their BP and their weight before they go in to see the doctor. And each time they come, they have to pay for a strip.
How much was it?
5 cedis for a strip.
Apart from that, what else were they paying for?
They were paying for their drugs. Sometimes they don't get their drugs in the hospital. When they get them in the hospital, they are free. But most of the time, they don't get them at the hospital. They prescribe for them to buy in drugstores, and a lot of them are not able to meet it. So in a month, somebody can go in a month without even taking the drugs, and then they will come back the following month, and it's so high. Then when you ask, they tell you they weren't able to purchase the drugs because of its expensiveness. And those were the things. And they are not also able to comply with the diet. Diabetes is also all about diet. It's all about diet. But they are not able to comply with the diet. That was one of our major challenges. They don't comply with the diet at all. We tell them, all right, you can eat anything or you can eat everything, but in smaller quantity.
Were you regularly getting the strips and other items from the Ghana Diabetes Association?
Well, sometimes. Not regularly, but sometimes.
Okay. And usually what was the challenge with that?
The challenge with the strips?
Yes.
And that's what I say, it's sometimes expensive. If we get it from the diabetic in Accra, it's sometimes better. But if we run out, we have to buy from shops. It's expensive.
The case is not any different at the Komfo-Anokye Teaching Hospital in the Ashanti region. Former Principal Nursing Officer at the Diabetic Center, Janet Obimpe, confirms that those in charge of the insulin brought to the hospital were selling it off to patients. This is not the arrangement under the Life for a Child program.
I quite remember once I asked where the insulin was coming from and then why were they selling it. And they told me that when it comes, they go there to retrieve the insulin and it comes with a cost. So they were subsidizing it to the clients. That is what I know about it.
When such a situation happened, what's the impact, or what was the impact you observed at that time?
Well, at that time, because the insulin in the government system was not coming, and this one was there and it was subsidized, the cost was a little bit low than those that they buy from outside. So those who could get the money were buying it.
These desk officers who serve as interface between the Diabetes Association and children living with diabetes are not the only officials engaged in these underhand dealings. In 2016, Ms. Denyo sent 600 vials of insulin meant for children to be supplied to adults in CAF. This is another practice the donor agency frowns on. Dr. Safo Kantanka is at the diabetes clinic in the Komfo-Anokye Teaching Hospital.
In terms of number of vials, we received 600. They were in 3 boxes, but it was 600. So it came and in the clinic folders and in the clinic record, it's well stated in the number of vials and the number of boxes that we received. So in fact, as a matter of fact, I cannot check from her side, but I'm telling you for a fact that the number of insulin and the particular brand, it was only one brand, Mixtard, that we received in 3 boxes.
Who were the beneficiaries of these insulin?
The beneficiaries of the insulin are people with diabetes that we take care of. That is adults. That's patients who are above 25 years. Like, that's how we classify. Who are on insulin, you understand? That means they will require insulin to control their blood glucose as against drugs like Dianel or gliclazide or any other drug like that you take orally. There are some patients like that who are on only insulin that will be able to help them survive. So they are that category. And unfortunately for us, some of those patients are on high doses of insulin, so that the National Health Insurance is not able to provide the amount they need, probably for a month or so. So they will then have to go and buy. Some of them, they don't have funds. So then they give us that information and we prescribe for them, and we alert the nurses that this and that patient will require insulin. And then they go and get it free of charge. So in fact, if anybody says that those insulins are given to adults, then it's the truth.
But are you aware that this insulin is meant for only children? Was that indication made to you?
The indication, I know that there's a particular program under the International Diabetes Federation which supplies insulin to deprived countries like ours for adolescents and children. Yes, so I know. But in the same way, if we are getting donations from the Ghana Diabetes Association for our patients who are indeed lacking, we cannot say no. We cannot reject it.
JoyNews checks also uncovered that the president of the National Diabetes Association of Ghana, Elizabeth Denyo, has been undersupplying diabetes drugs meant for the various hospitals listed to the donors. An internal email between the donor agency and its representative here in Ghana, intercepted by JoyNews, raises queries about supplies of diabetes drugs by the president of the Ghana Diabetes Association. In 2013, the Komfanochi Teaching Hospital got 240 strips instead of 730 and 20 lancets instead of 50. My checks confirmed the diabetic clinic at Kath did not receive the full consignment as communicated by Ms. Denyo to the donor agency. Dr. Emmanuel Ameyao is in charge of the diabetes clinic at the Komfanochi Teaching Hospital.
Somewhere into 2013, we realized that it became very irregular. So we started getting these insulin and glucometers and strips from Life for a Child, Australia. At first, they brought us 50 meters. That's what we were supposed to have received, 50 meters, 330 strips, and 50 lancets. But when it came, we realized that we did not, it was short. We didn't get the number. Okay, we didn't get the exact number that we were supposed to get. We got all the 50 for the meters, and we got all, but we did not get about 490 of the strips. The strip each has 50 in it. So about, we got only 240, and we did not get the lancet to 30 of them. Actually, the portion that went to Accra at that time were 250 glucometers, 3,650 strips, and then a lancet 250. You see, it goes to Accra, and then our portion is brought to us in Kumasi. And around that time, that is, this was in 2013, we did not get this. When I probed further, because we had to account for anything that we received, we got this information back from Australia that Elizabeth A.C. Denyon, the president for Ghana Diabetes Association, said she got 50 meters and 240 strips. She rather gave 72 meters and 360 strips to Prof. Egan, and 22 meters and 120 strips to Wa and also to Tamale. Okay, but my assessment later on proved that this. In fact, I talked to Prof. Egan, and he said he didn't receive anything. I talked to the doctor in charge of Tamale. In fact, around that time I had gone there. We also go to lecture there from time to time. I went there and I visited diabetes clinic, and the doctor there, Dr. Henriado, told me that even the children, most of them had died for lack of support.
Did you raise these concerns with the president of the association?
Yes. In fact, when I confronted her, especially for our portion that did not come, and she was angry with me. First, she told me that it was not. We even didn't have enough. We didn't have enough. We didn't have the proportion that they said they would bring from Australia. Those that were supposed to come from Australia, she didn't get them, and she gave us what she had. So I found it actually mind-boggling. I found it confusing to understand. So I went back to the Australia, and then they came with this statistic that she said she had given to these areas, and they proved out to be false.
Is it still a challenge that your center is still encountering, or it has
for our center here, because of this hustling that we've been having around, it has improved. Because if you look at when they did this, when they do this distribution from Australia, there are clear statistics. Portion that comes to Kumasi, portion that stays in Accra. So when it comes, at first I was taking the delivery, custody of this, and then giving to them. But right now, Konfanochi goes for it, and then we give the prescription, and it's given to them. So for here, it's no problem. I think the problem is with the centers in Accra, because we met we had a conference, that is pediatric endocrinologists in Africa. We had a conference in March. So when this came up, and we met we wanted to meet the president for Ghana Diabetes Association, that's A.C. Denyon, but that was not possible. We didn't meet her. But the general manager for the IDF, Life for a Child, those who've been supplying us with insulin, came around, and we went to Kolebu. We saw Prof. Goka. We met with the doctor at the Ridge Hospital, Dr. Fishian, and they were not receiving anything. In fact, I talked to Dr. Fishian about some 2-3 weeks ago, and he said if Kolebu was supposed to receive 1,500, but they received only 100 vials of insulin instead of 1,500. And according to her, I'm not sure, but she says she has not received anything or so. So find out from her. And even I knew Nanama Barnes was supposed, last year for instance, was supposed to have received 90 and 900 vials of insulin for the children with diabetes who are attending clinic at Efia Nkwanta, and she didn't give, and they never received it up to even though she said after some time some came or something, but things have not been streamlined.
Miss Elizabeth, in this same correspondence to the donor, stated that in 2013, for Tamale, she sent 22 meters and 180 vials of strips. For Sunyai, 22 meters and 180 vials of strips, and also for Wa, 22 strips and 180 vials. But this is the period almost all the children living with diabetes died at the Tamale Teaching Hospital. Dr. Henriado of the Diabetic Clinic at the Tamale Teaching Hospital recount this dark moment in 2013.
Juveniles coming in with diabetes. But the northern region being a deprived area, we started the clinic about 15 years back, and unfortunately we've lost most of our time. Because before the inception of the health insurance, they couldn't afford the insulin. So we virtually lost almost all of them.
According to the email, President of the National Diabetes Association of Ghana says she sent former head of the Diabetes Clinic, Professor Benjamin Egan, 72 glucometers and 360 strips. So, 22 meters and 120 vials of strips must still be with Professor Egan. This is a claim the recipient denies. Ms. Daniel, however, says there was an unofficial agreement to give some of the drugs meant for the children to adults.
Like I do, if you check the date, that was when we were trying to do the procurement and things. So again, there is no way we would accept to you that something came to you because it would be a breach. Because we gave it to the adult diabetics there. I can give you the number of the residents there, and he will confirm the things came to you.
So the reason why he didn't, he said he didn't get it was that it wasn't given to children, but it was they were given to adults. Okay. Because I went to his hospital. He actually
on dialysis center.
Yeah.
So please, if you continue with this, it will be a mess. It's just being mischievous.
Okay.
But I will give you the number of the president of the association in Kumasi. I'll give you the number of Dr. Safo Kantaka. I spoke to them. This is it. The adults are suffering. So each time, even the stock, we will give them. But it mustn't be on record. So if you are a good person, why are you doing all this? There's no way Prof. Egan will accept. Even me, I won't accept. Do you understand it now?
Okay, so you only stated it in the mail so that you'll be able to help save lives.
And Professor Ogle knows Dr. Egan. Even Ogle himself, openly he knows what we are doing. But then he always tells it's in such a way that clean. Say you are doing NGO, you are picking your supplies. What is your problem? And the person has kept his name. I'll give you Dr. Safo Kantanga. I'll give you to them back. They are not on any record. Because Kumasi has the higher rate.
She tells me her figures to the international donor is inflated. In reality, she attends to 670 children, but on the record, she puts the figure at 712.
The white people decided that when we take it, let's charge everybody 5 cedis for a glucometer and a strip, so that we can have money to run ourselves as an association. Are they not allowed to? So what's the problem? Once I give it to them free, I don't care what happens. Even Kumasi people were calling that they are charging. I say I don't want to hear. But the good thing today, I'm happy that everywhere when they tell that I give it free.
Yeah.
I have made sure it goes free. But when it gets to the facilities, they need to run themselves. And Ghana is not the only country. I'm the chairman for Africa. Tanzania is doing it. Even Tanzania's president is always fighting with me. They ask for you are too good. But I don't want any finger to point back at me. I give it free. But when it gets to the facility, I don't want to know what you did with it. TB has a high rate of diabetes. And they are the villages, they can't afford. 712 for young Colano, they are 670. So definitely a big age. Medium penny for I usually have someone who got the mouth touch on letters.
This means the president of the Diabetes Association diverted 772 out of 13,104 vials of insulin to unintended beneficiaries in 2015 and 756 out of the 12,816 vials received from the donor in 2016. That is, in 2015 and 2016, a total of 1,528 vials of insulin were diverted from the supply meant for free distribution to children. This year, her association has received 12,752 vials of insulin to be distributed. The average price of a vial of insulin is 55 cedis on the market. Then it means this is worth 84,040 cedis. Here in Accra, Ms. Daniel tells me she supplies Kolebu Teaching Hospital with insulin for emergency purposes only.
Life for a Child and the Diabetes Association. So Life for a Child supplies the insulin. It's the duty of Ministry of Health to clear it. Then after it clears it, it keeps it at the medical stores in the Ministry of Health. So if we also need it, we write for supply. Even though we have direct access to it, we pass through the channel. So if, let's say, a Sikado hospital needs strips, we should always make room for insulin. We should always make room for eventuality. So if they come in and they say we've got 11 children, we supply them around 20 so that if there are new people, they are covered. So currently we are concentrated on the southern Ghana, central region. Those who Abigail cannot get, we leave them at Interbetin Hospital Diabetes Clinic. Isikado Hospital too is taking the supply for Western Ghana. Suhum Hospital for Eastern. Akwetia, Isamankese, we've got Akwetia, Isamankese, Etibie Kwewu, Nkoko, Sugakope, Adidome Hospital, Keta, Hohoi, Bando are our main people we give.
How about Accra?
Accra, we stock some at the Child Health Pharmacy because it's the central and we can't guarantee how many children can come. We supply, we always make sure their fridges are full of insulin so that any child that comes at any given time can access. But Accra is easier because Abigail knows all the children, so she goes from house to house to assist them.
Do you supply Kolebu and Ridge and then these hospitals here in Accra?
As I'm saying, so far it's only Kolebu that I stock. Kolebu stock that I stock is for emergency because for any eventuality. But the children in Accra, Abigail knows all of them.